once again. Today I'd like to talk to you a little bit more about cardiovascular health and what it means to your overall health. Most importantly, what is it that you can do to prevent an event? Now we know heart attacks occur at a rate of once every 25 seconds in this country. Yet it's been stated that 80 to 90% of these heart attacks are preventable. Well, if they are preventable, what is it that we can do to prevent them? Here at Expanding Choices, we have a program called Prevent an Event, which utilizes some of the latest technology to identify cardiovascular disease at its earliest stages when it is most preventable. Now, the cornerstone of a cardiovascular event is soft plaque along with inflammation. Now, soft plaque you can think of as a blister, which can rupture and release a clot and block off a blood vessel, or it can travel downstream and cause further damage, such as a stroke. Now, when does this soft plaque rupture? It ruptures in the presence of inflammation. Now, we can lower inflammation through diet and lifestyle measures and appropriate targeted supplementation. But in order to do this, we need to look at a comprehensive blood chemistry panel which can identify inflammation and help us to set up a treatment program to reduce this. So a comprehensive blood chemistry panel is essential if one is interested in preventing an event. This includes much more than just a total cholesterol level and a blood sugar level. There are many, many markers of inflammation that can clue us in to an individual's risk. Now, another thing that we like to do is utilize the HeartSmart IMT Plus. This is fantastic technology that was born out of research with USC and NASA. And with this, we can identify in the carotid artery, which is the large artery in your neck, whether or not you have plaque, and if you have plaque, is this plaque hard or soft plaque, or typically it can be a combination of both. And also we can identify what is the thickness of the arterial wall, and how thick this is a very important marker in identifying risk, as well as identifying what is the rate of increase in this thickness year over year. So it's easily reproducible, it's painless, it's non-invasive, and takes maybe 10 to 15 minutes to accomplish. So along with this test, the HeartSmart IMT Plus, and a comprehensive blood chemistry panel, we can identify if you have plaque and if you have inflammation. These are a deadly combination and need to be addressed immediately. Some other very important tests that you can do are a pulse wave velocity. And in essence, this is a test that identifies the flexibility of your arteries. We all know that the more flexible your arteries, the more youthful they are, and the more stiff your arteries, the more older they are and the more risky. Now, we often will see patients who are relatively young but have stiff arteries, so it doesn't necessarily correlate with your age. And also, it's important to note that the flexibility of your arteries, which can be detected on this pulse wave velocity test, is not correlated with your blood pressure. So you may have an excellent blood pressure, but not necessarily an excellent report on your pulse wave velocity. So it is important to obtain this test to fully identify the status of your arterial tree. Now, along with this pulse wave velocity, we utilize heart rate variability. And this is the variability in your heart rate from one beat to the next. Very important, very critical for cardiovascular health. This is also a test that takes about 5 minutes, simple, painless, easily reproducible, and something we can follow year over year or even more frequently if needed. And this is maybe one of the more important parameters of your cardiovascular health and is related to your autonomic or automatic nervous system, essentially your fight or flight system. And through appropriate stress reduction techniques, which could include meditation, guided imagery, breathing exercises, something that I've been a big proponent of is heart math. That's heart, M-A-T-H, heart math. And all these are very useful techniques to incorporate into your daily life that can help maintain appropriate heart rate variability and maintain excellent health of your autonomic nervous system. This in turn can reduce your cardiovascular risk. So if you are interested in understanding what your risk is and receiving a treatment plan to help reduce or mitigate this risk so that you can prevent an event, please give our clinic a call at area code 505-508-1745. We are Expanding Choices Incorporated, located in Uptown Albuquerque. Thank you for joining me today, and we look forward to working with you so that you can prevent an event.